Hey all, I'm Chung Brewer. If you work with adults in the inpatient or home health setting, you're going to see a lot of patients who have memory impairments. I want to share 3 go-to tasks that can be incredibly functional with many of your patients. Number 1, use a monthly calendar. Give them a blank calendar, there's one in the Adult Speech Therapy Workbook, and ask them to fill it out, especially if they have a moderate memory impairment. If they have more of a severe impairment, you might need to fill it out for them. Just keep your writing very neat, about 24 point size. Use black marker on white paper. Review the month with them. Ask them things like, what's today's date? What's happening this week? What holidays are there? Any family birthdays? You're probably going to have to check with their care partners to double check about those birthdays. That's very common. Then refer back to this calendar every session. Even you could do it at the beginning and the end of each session to review what's going to happen next, to cross out the speech therapy session if that's written down on their calendar. Encourage them to update their calendar daily, writing in new appointments, crossing out the days as they go along. And as they improve, you can switch to whatever calendar system they like a planner or a calendar app on their phone. Number 2, teach them the memory strategies. You could literally turn this into a memory task. Pick 2 to 3 memory strategies that you believe your patient would benefit from. The ones that most of my patients can connect with are repeat, 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 write it down, visualize. You can use each of these strategies to memorize the memory strategies. It's super meta. For example, you ask them to write down each memory strategy, write it down. Then ask them to repeat the list over and over again, repeat, repeat, repeat. Finally, ask them to visualize a paper as they say the strategies out loud. Eventually, you could use these strategies in daily tasks like remembering their food order at a restaurant or remembering what was said during a phone call. Number 3, remember safety precautions. Many times when our patients are in acute settings, they're going to have some sort of safety precaution or safety tools like call lights, mobility devices. Use spaced retrieval to help them remember those things. For example, if you want them to remember to use that call light instead of getting out of bed independently due to safety concerns, ask them the following question. What do you use when you need help? And provide the answer, use the call light. And show them the call light too. Ask the question again, and their answer should be exactly use the call light, no more, no less. Wait 15 seconds, ask the exact same question again, and expect the exact same response again. Then you're going to ask again 30 seconds later, a minute later, 2 minutes later, it goes on and on.